Welcome to the IDD Perspective webinar series. Our first one today is on top dental concerns in people with intellectual and developmental disabilities. I'm your host, Craig Escudé. I am a family physician. I am board certified in family medicine, in developmental medicine, and also a fellow of the American Association on Intellectual and Developmental Disabilities. I provided healthcare for people with IDD for over 20 years clinically, and now work with Intellectability, where we provide tools and training such as this to help supporters of people with IDD recognize health risks and improve health and wellness for people with IDD. I'm the author of the Clinical Pearls in IDD Healthcare and the Curriculum in IDD Healthcare, and the host of the IDD Matters Health podcast. Our special guest today, I'm so excited to introduce you to Dr. Dian Chin Kit-Wells. And Dr. Dian, is it okay if I call you Dr. Dian?
Absolutely, thank
Great.
you.
So
Yes.
Dr. Dian is a board certified pediatric dentist. She's a clinical associate professor at the University of Buffalo School of Dental Medicine, and she's the president of the American Academy of Developmental Medicine and Dentistry. That's an organization very near and dear to my heart and yours as well. So Dr. Dian, say a few words about AADMD before we get started.
Sure, absolutely. So the American Academy of Developmental Medicine and Dentistry is a nonprofit membership organization. It consists, and you're going to love this, of physicians, of dentists, of nurses. It's interdisciplinary, and it is throughout the nation and global as well. We also have student chapters. So right where I am today at the University at Buffalo School of Dental Medicine, there's a group of students, 30 or plus more, that are dedicated to care for those with intellectual and developmental disabilities, not just in the clinic, but out into the community as well too. And that is all supported by the AADMD. You are welcome to go to the website and see all that it encompasses. Our next conference will be in Phoenix, Arizona. You all are more than welcome to join us there, and I can get you more information as you need. Just know that we are near and dare to care for those with intellectual and developmental disabilities, educating the providers, providing quality care and advocacy as well.
Thank you so much for that all that information about AADMD. I've been a member for I don't know how many 10 or 12 years now, and just love the organization. And all of these credentials are great, but I've just got to say, Dr. Dian, you are one of the most special people that I know. You're a dear friend, and the incredible work that you do in this field is amazing. I'm so glad you're here to share information about dental health for people with IDD. Now, when I asked you to send a few notes to help get this presentation, get the things rolling and figure out what we're going to talk about, one of the first things you said was this: the mouth is the gateway to the body. Can you tell us a little bit more about that, and what does that mean?
Absolutely. So, first, I have to say thank you, Craig, for all that you do for persons with intellectual and developmental disabilities. It's really easy to be your friend, when you see somebody pouring out their heart like that and providing such education. Okay, I said all of that with my mouth. I'm giving you a message. The mouth is doing the very same thing about your body. When I take a look at my patients, when I look at their smiles, when I get a good look at their oral cavity, the teeth and the gums, I can tell if there are other physiological issues that the mouth is trying to tell me, whether it be a fractured tooth or swollen gums or whatsoever. I mean, this is the entryway for the food that goes in to sustain us. It is the exit way for us to communicate with those that we love and those we need to communicate with. But every single one of those teeth, lately I've been seeing so much about the teeth of the crystals. It is the hardest substance in the entire human body, and yet it can be so easily damaged and destroyed. And many times it's given us a message that there's more going on. And so that's why I say the mouth is the gateway to the body. If we paid attention to our oral cavity the way we would to a hole on our hand or whatsoever, we may be able to answer messages that will lead to total health. Oral health can lead to total health.
That makes perfect sense to me. Now let's go into some specific areas or some specific conditions that we might see and talk a little bit more about what they could indicate in anyone, really, including people with intellectual and developmental disabilities. So one of the first things that we might see is something related to the gums or some swollen or bleeding gums. So would you tell us a little bit about what that might mean?
Sure. So the technical term is gingivitis. And of course, I want for this talk to keep it simple first, right? Simply, gingivitis can be caused by poor oral hygiene. So those of you that are taking care of persons that are not able to take care of their own oral health, right? Wherever plaque collects, and we know that plaque is the debris from food, it is bacteria and all of the toxins that go along with food that is staying there for a long period of time. We know that that releases acid. And if you can imagine pouring acid on your hand, now imagine a mouthful of acid, the gums are going to react. They're going to become swollen, they're going to bleed. And again, the messages are being given to us. So poor oral hygiene can lead to swollen gums and to bleeding gums. We put a couple other things there too, if you want me to run through that.
Yeah, please do.
Sure, as you can imagine as well, your saliva is there to dilute that acid and to move things around. And so, if you are suffering from dry mouth, or the person that you care for is suffering from dry mouth, there is not that saliva to dilute the acid. And once again, you're going to see those red swollen gums. And then there's medications, right? And Craig and I were talking about this before we got on. You know, we all know that again, gingivitis or gingival hyperplasia is another way you can talk about swollen gums. Medications such as antihistamines can lead to that. Antidepressants, calcium channel blockers. You know, and how many of our patients are on those? Very many.
Yeah.
So,
And
you
that's
know,
why yeah, it's so important to know the side effects of the medications that are being
yes,
used in people with IDD and
yeah.
to know what to look for if we see early signs of things. And another thing I was thinking about related to medications, so many medications cause a dry mouth.
Mm-hmm.
A lot of these antihistamines and anticholinergic medicines and some of the medicines that are used to counteract some of the effects of psychotropic medications can cause a dry mouth. And so what it sounds like is those types of things can cause gum disease as well.
Exactly, right? Wherever the plaque is collecting, the gums are swelling, there's no saliva to dilute it or move things away. And so, yes, this is quite a common problem. Anticonvulsants as well, Craig, right?
Yes.
You know, our patients that have seizure medications as part of their daily routine, we see the gum tissue just react so poorly to that. And many times we have to work with the physicians and see if we can make some changes to the medication. But you know what's most important on the totem pole to make sure that they're seizure free or to make sure that their gums are not swollen. So that's where the caretakers play a very important part. We can, even if they're on those medications, we can help keep those gums in a healthy status with good cleaning, with good brushing, flossing, and finding those areas where the plaque is collecting and going right after that to care for it.
So I see also on the list that the gum problems can sometimes maybe indicate other conditions.
Yeah, yeah, absolutely. And diabetes is one of the biggest ones. And, you know, it's such a complicated relationship between diabetes and gum disease or oral health, right? If we have poor oral health and there's inflammation, that could actually put you at risk for diabetes, right? If you have inflammation from not brushing well and you have diabetes, it can make it even worse. So, you know, we know that if I see that I am caring for my patient. I am brushing, I'm flossing. They're coming in. We're doing all the right things. We've given them pilocarpine or whatsoever to take care of the dry mouth, and the gums are still reacting poorly. We all know with diabetes, there is a risk of very poor healing. So now I want to reach out to the physician and say, you know, can we check this patient for diabetes?
That's a great point for sure
Mhm.
to think about how diabetes could, or that could be a sign because we know that diabetes can reduce our ability to fight infections.
Right.
So I guess it can in turn relate to gum disease as well. What
Yeah.
about aspiration pneumonia and poor oral health? Isn't there a tie between those things?
Absolutely. So, I mean, poor oral health means that there is an influx of bacteria and bacteria that can be very damaging to a person. And so, I know that you all will be taking care of patients where aspiration pneumonia is a risk. And, as we just need to keep that oral cavity as clean and cleansed as possible to reduce that from all happening.
Well, as we move, thank you for that great information. As we move on to the next topic, I want to let everyone know that in your control panel, there should be a little arrow pointing to a word called handouts. And if you click on that, you'll be able to download a handout that relates to today's talk that has information about oral health and how to improve oral health for people with intellectual and developmental disabilities. So let's go on to this next topic here. We call it halitosis, or bad breath. So what can that indicate when we see or maybe smell bad breath in people that we're supporting?
Yeah, a lot of people ask me, how can you be a dentist? And I mean, I've been a dentist from before the time where we wore a mask, right? But keeping it simple again, trapped food. So,
Mhm.
you have your coffee breath, you have your onions and your pizza whatsoever. And for a lot of our patients with disabilities, they may have crowded teeth where food is trapping. And so again, the cleansing to reduce not just the swollen gums and the risk of cavities and so on and so forth, but to decrease food trapping and halitosis. It comes from the plaque. It comes from the sulfur that's released when food has been trapped and bacteria have been there for quite a while. But it also can be due to digestive issues. So again, we go into the systemic, that connection
Mhm.
between right, oral health and total health. I mean, what is there that is occurring? Oftentimes I'll refer to a gastroenterologist, because I'm doing all that I can possibly for the person that I'm caring for, and the family is still complaining of halitosis. Is it something more that's occurring? Is it swollen lymph nodes and food gathering in that area? Do I need to talk to an ENT? Or is it the foods that they're eating or some other GI problem or some chronic disease that's occurring? So again, when these situations occur, don't brush it off lightly. Especially if you're doing all that you can to make the situation better. If you're not getting healing and results, then more than likely there's a possibility of a systemic connection.
That's really interesting, and I love to hear you talking about the connection between oral health and the rest of the body's health. We are very siloed a lot of times in what we do. We have mental health that's very siloed. We have oral health that's siloed, and then we have medical
Right.
health. And all of these things really work together. I mean, they're all connected in our bodies, right? And it
Yes.
just stands to reason that so many of these conditions can be interrelated, or we can see signs of one thing that can cause something else. And I think that's really great for us to hear as supporters and as healthcare providers and people with IDD, is to think about the oral health reasons or oral health conditions and that connection to other medical conditions as well. So
Yeah, for sure.
something else that we have on the list to talk about are tongue color changes. We might see changes in the color or the appearance of a person's tongue. So tell us about that.
Absolutely. Again, the tongue can tell us so much. And yes, I'm always looking for a pink, healthy tongue. And if there's staining, I'm in pediatric dentistry as well as adult care for those with disabilities. You're going to keep it simple again. It could be the food, could be the coffee, it could be all that junk that folks sometimes are eating. And, people enjoy their Cheetos and Doritos and so on and so forth. But if we're brushing that tongue, if we are taking care to remove whatever food deposits are on there and we're still seeing color changes, it could be because it is an unhealthy tongue indicating again, telling me the story that there's something more that's occurring. A tongue, for instance, that might be stained yellow, and you know that this is not somebody who's using tobacco. You're doing all that you can to keep it nice and clean. it may be an indication of jaundice or some type of liver condition. So,
Mhm.
take a look at your person's oral cavity and figure out what the story is, and please do those referrals. Um,
Yeah,
I see that we
that's
have geographic tongue on there too. Happy
yeah.
to
I wanted you to explain what that is.
Yeah, yeah,
Yeah,
yeah. So the technical term there is benign migratory glossitis. So glossitis,
I'm
inflammation
going
of
to
the
stick with
tongue.
geographic tongue. That's
Yes.
easier.
Yeah, yeah. It's really fascinating to see. It's one of my favorite things to look for. It is inflammation, especially of the papilla, right? The taste buds that are there, where there will be some areas where the taste buds are not there. It's almost that they have migrated, hence migratory. And so it will leave this very interesting pattern that looks like a map. And today it may look one way, and then you see the patient 6 weeks from now, and it has moved to another pattern. So this change in pattern on the tongue that's related to the papillae is missing in some areas is known as geographic tongue. And they can have some symptoms, Craig, with this.
That's what I was going to ask you. Is this a sign of a
Yeah,
disease or does it cause problems? And one
yeah.
person's asking, does that change the way a person tastes things?
Yeah, I have heard that for some patients. Not enough research is done around geographic tongue or anything with anomalies in patients with disabilities, which is why I'm part of AABMD to make
Hmm.
changes there. I do see a connection to psoriasis, so skin conditions
Interesting.
where there's dry skin, and many will talk about sensitivity to spiciness rather than how does something taste, which is a brilliant question, right? Because we're talking about taste buds that are missing. They'll talk about sensitivity to food, spicy foods being a problem for a person with geographic tongue.
Very, very interesting on the spicy food connection there and the sensitivity there.
Yeah.
It does. So if people are supporting someone and they notice these different patterns on a person's tongue, is that something that they should call attention to a clinician, a dentist about?
Yes, it's not urgent, of course, unless it's symptomatic, right? So if they are having discomfort, problems with it, which is typically when we will see it, when a parent will point it out to us or a caretaker will point it out to us, is when it has been symptomatic for that patient. But other than that, it's almost seen as an anomaly. About 3% of the population have geographic tongue. And, when you see it, especially in a dental school, it's, oh, that's so cool, but I'm looking for where it is symptomatic, where it is a problem for a patient. And I will start asking about, are there any other lesions on their skin or so on and so forth. So I would say, I mean, I want anything to bring you to the dentist, and I want more dentists to see your patients. And so, yes, making an appointment so that you can have the dentist take a look. I think it's a great way to make an introduction with your dental team.
Very, very good. Very interesting there. All right, let's talk about something that we see, I think probably a fair amount, and that's
Mhm.
erosion of tooth enamel and the things that that can indicate.
Yeah. We began this conversation about talking about how strong our teeth are, right? Hardest substance in the body. If all else fails away, the teeth will stay and stand the ground because they are the hardest substance in the body. And yet, acid can erode it. And so, what you're seeing there is acid erosion leading to that cupping or loss of enamel of the tooth. So we have to think, okay, where is this acid coming from? Keeping it simple, it can be diet. And so many of the persons we care for, and even ourselves, we're on the soda pop, the diet this, and all these different carbonated beverages that do have acid in it. The different aids and all these different drinks that you want to take a look at the content and see, and know that water really is your best option for when you're thirsty, and the same thing for those that you care for to do that. But there's also the case of stomach acid and GERD. So again, when you're doing everything possible, you've got their diet right, They're drinking lots of water, you're brushing, you're flossing, and you're still seeing this erosion. Know that it can be from stomach acid and gastric acid that's coming into the oral cavity and reducing, destroying, damaging that enamel that is supposed to be nice and strong and healthy that's there.
So let me ask you a question about that. So I think that's a really important point for everyone to think about, is that refluxing, gastroesophageal reflux, refluxing acid back into the mouth brings acid there, which can damage the teeth. And there's something I learned years ago from one of the dentists at ADMD that I thought was pretty interesting, that I'd never thought of before. And it's something that I've heard of called a step off erosion, where a person might have a filling, but then there's a kind of a step down because the tooth has eroded below that filling, and that can be a sign of reflux. Do I have that right?
Yes. Yes, you do. And I mean, it's almost like the cupping forms around a filling, where it's of concern sometimes is in patients with eating disorders. So, we take a medical history and the patient is fine and we do the fillings and then they come back and we see that step off, or loss of enamel around the filling. And you really have to, I want my dentist to not just treat the teeth, you're treating the entire person. You have to have that conversation with them and try to help figure out what has occurred here. The mouth is telling us a story.
Yep.
Is it that they have bulimia? Is it, what is different? Is it anxiety that's causing, more acidic responses when they're nervous? What is going on? So yes, you do have that right. And I admire that your dentist, the dentist you spoke to took the time to point that out. Because
Yeah.
again, teaching at a dental school, I don't want it to be just about, oh, there's a hole in the tooth. I want to fill it. Now you need a root canal. Now you need to extract it, right? You are a part, you are connected to this human being and everything about them. And I really think that the care, the work we do for patients with intellectual and developmental disabilities is what's going to unite us to think about people holistically and not just the teeth, or the rest of the body and not the teeth, you know? So no,
One
you're right.
wonderful words of wisdom there. Let's talk about clinching or grinding for a minute. That
Mhm.
can cause some changes in the teeth and erosion of enamel too. That can be a pretty challenging problem to address. Even for me, I clench my teeth at night and I can't figure out how to stop. You have any
Mhm.
advice on that?
Absolutely. So, of course, for a neurotypical person, we will bring you in and, probably take an impression and make a night guard if you're grinding or clenching at night. We'll talk to our TMJ specialist and see if there's any therapy we can recommend for you. But for a person who has challenges communicating what's going on, I have to use that dental exam to be able to see what's there, depending on who they're with. And we know caretakers can be so amazing. They'll let us know, okay, they're all night long. I can hear the bruxing all night long. I can see the clenching that's occurring with this patient. But if no one's communicating it, I'll be able to tell. You will see the wearing away of the enamel. You will see that just grinding down. You can almost see how one tooth fits on top of the next and what is that pattern of grinding that's going on. And now here's the problem. If that continues, that's trauma to a tooth. And when there's trauma to a tooth, the nerve reacts, and that nerve reacts negatively. Tiny pores can be formed where bacteria can enter to that nerve, right? It's getting closer and closer to the nerve. It's trying to build up a protective layer as much as possible. Your mouth is really trying to protect itself, okay? It's trying the best it can. But once it gets close to that nerve and if bacteria enters, you can now have an abscessed tooth. And now you'll need to have a root canal done or have that tooth extracted. And for a person with challenges just getting into the chair, it really is so devastating. I can think of, patients that have their smile is everything. Those front teeth are everything. But maybe it's a change in life or a change in medication, and the grinding and the bruxism sets in. And the next thing we know, they have an abscessed tooth. And here's someone that I don't want to have to put everybody to sleep for treatment, but if I'm going to save that tooth, I'm going to need to do a root canal. And I'm not just saving a tooth, I'm saving a smile. I'm saving their dignity, or the person who cares for them. That's their connection with them, that smile and that dignity. So it's really important if we could all work together to help reduce these things. Is it occupational therapy? Is it medication? Is it finding a way to get that night guard in to reduce the bruxism?
And speaking of working together, how can supporters help? What can people who support people with intellectual and developmental mental disabilities do to uh, help with good oral hygiene and to improve oral health overall?
Right. So prevention is number one, right? And I know it's not always easy to get in there with the brushing and the flossing, and I put baking soda in there because you remember your grandmother used to use that. It reduces the acid, right? They knew what they were doing. So maintaining good oral hygiene for your patients, for those you care for. If it's brushing and flossing can't work, or watch that diet, right? The less fermentable carbohydrates, the better. The more fruits and vegetables and cleansing foods you can have. An apple a day does keep the dentist away as well too. Water, things like that, the better it is, right? I think about some of my patients that can't have vegetables. It's you know I remember one patient in particular. I knew then that I needed to see this patient more often. If this is something that is not part of their diet, then I need to help their caretaker get in there with that brushing and flossing and use of baking soda. So yeah, there are ways we can work together to prevent the having to be taken to the operating room for treatment. And I'm very, very invested in training everyone, not just dental students, but everyone to do the simple, basic brushing, flossing, home remedies to prevent things from getting worse.
Could you touch us a little bit more on baking soda use? We have
Sure.
someone asking a question about it. Is that something that's recommended daily, or how would you recommend that being used?
Yeah. Well, with everything in dentistry, it really is person specific. So I would want to take a look and see. So let's say it is mild gum disease, mild bleeding gums, and then I would say you don't have to use a baking soda every day, because baking soda, if you can imagine, is a bit caustic too, right? So for me, I dilute it depending on if it's mild, moderate, or severe, the oral hygiene that I'm seeing, or the gum disease. I would then say use it on weekends for those that are mild, every other day for those that are in the moderate category. And if it's severe, I will say use it every day for 2 weeks and let me reevaluate at that point.
Is this something that you'd recommend a dentist seeing the person first and then making that recommendation to use baking soda, or is that something that's safe for most people to do on their own?
It's safe for most people to do on their own, but if you're doing it on your own without having a visit to the dentist, I would say then you want to go to that once a week. But I would want a dentist to take a look and decide, how severe is the case that I'm seeing here? Is it mild, moderate, or severe? And then make the recommendations from there. If you are in a remote area though and you cannot get to a dentist, I'm telling you, you will see good results when there is red, swollen gums, bleeding, to use baking soda at least once a week.
Great advice. So we're coming to a close here, to the end of our 30 minutes, and we wanted to make these webinars, something beneficial with lots of information, but something that's not too long. So I know we could talk forever about all of these things, but a couple of other thoughts here. Are there any particular resources that you would recommend for supporters to learn more about dental care? And support, or people that they could contact?
Sure. So I will always have to say to go to where our guidelines are from, the American Dental Association, so the ADA. If you're working with a pediatric population, the American Academy of Pediatric Dentistry. We know we all can Google, but as you do your searches, do look to make sure that the information is supported by the National Institute of Health, the NIH, the ADA, the AAPD, the AADMD, for instance, all your webinars that you do, Craig as well too. And find that local dentist. If it's not a private dentist, you can call any university, any dental school, and ask for a virtual outreach. I think we have to. I'm going to get the schools ready on this end. If you can get the community ready to make those asks, I have clients that will benefit from more knowledge. I need more knowledge. The AADMD, of course, we now have our national curriculum on health education for populations with intellectual and developmental disabilities. It's called Niche, and there is Niche Dental. And there is information there that would be beneficial. It's not just for faculty, it's also for persons in the community such as you. But basically, the ADA, the AAPD, NIH, and call and reaching out to your universities. We have to be more responsible for providing you with sound information that's based on guidelines and facts and science research, okay, and not just hearsay.
Excellent, excellent information. So I want to end with just a couple of things here. Remember, in the handout section, you've got a handout. It's a 3-page handout that really consists of these 2 clinical pearls from the book Clinical Pearls in IDD Healthcare that talk about good dental practices and how what dental causes can be signs of or how adverse behavior can be signs of dental pain as well. So a couple of things to look at. I want to thank you for joining us today. There are a lot of questions and a lot of interest here that I'm seeing here, and we don't have time for all of those questions. I tried to get a few in as we talked, but what this tells me is that we need to do this again. We need to have another talk on dental health and maybe cover some other topics. So we want you to look out for future IDD perspectives. And we've got a couple of more on the books right now. We've got one on what do behaviors mean and how to identify what behaviors are. We've got another one coming up about how to provide good support and preparing for a clinician's visit. We've got some great guests coming up. We've got another one on aging. We've got another one on person-centered thinking. So visit us at replacingrisk.com and look under the staff education under webinars, and you'll see a listing of other free webinars that are available to you. And I thank you all for joining us today. You will get this recording and it'll be made available everywhere. So Dr. Dian, thank you so much. I think it's clear to everyone, why I asked you to be on this show, because you have such great information and you're so passionate about what you do. And I really, really thank you for the work that you do in this field.
Thank you, Craig. Thank you for the opportunity to talk about something I'm passionate about. Thank you.
Okay, goodbye everyone, and we'll see you next time.